Dr. Philip Yu at the 21st Century Regenerative Medicine Institute, and today we're doing Sandy's reevaluation. 1 month she had some laser-guided umbilical cord stem cells grafted in her lateral knees because she was getting genu valgus, which is knock knees. I'm going to reevaluate the inflammation in the knees with my instrument thermometer. So if we look at her records, we could see that before she had a lot of inflammation on the outside, on the lateral knees, because that's where the knees go bone on bone. So today, her left knee is 86. So I'm going to write it here. See that? Before it was 91.6. So the left knee has gotten a lot better. That's about 5 to 6 degrees less inflammation. And I can see there's less swelling there. You can see more definition. So we got 88.6 on the right knee. Before was 90.3. That inflammation is going down as well. Okay. And then, how has your pain and inflammation been after the procedure?
It's improved dramatically.
Really?
It really has.
No. About how many percent improvement with less pain, more function would you say?
A lot more function. I'm riding my bicycle
Okay.
regularly.
All right.
An electric bike, but it makes it easier on the knees too.
Okay.
And no, I can stand up and not have to wait a few minutes for the pain to stop before I start walking.
So before you felt like the Tin Man or Wizard of Oz and be stiff, you wait and...
Just wait before I would take a few
Could you
steps.
show us how you could just pop out of the chair and walk across the room?
And I'm in heels.
Look at you. And you couldn't wear those before, could you?
Well, I could, but it was painful.
Yeah. Come on in. Look at you. And the most important thing, she's wearing my alma mater, green and white, Michigan State. She's an honorary Spartan. Okay. Yeah. So overall, how many percent improvement would you say in these?
70%?
Yeah.
It's
You
been a
know,
month.
and you're making faster results than the normal patient, because remember I said you should expect about 8 to 10% improvement a month. So most
It's
people
been a
have,
month.
no, most people after a month are only 10%, but you're 70% better.
Much
You're like,
better.
it's like you're getting 7 months progress in 1 month.
I've told so many people that I walked in here in pain and walked out of pain.
Yeah, that's incredible.
Pretty remarkable.
So after we did the laser
And I
guided,
was very skeptical.
yeah. Uh-huh. So after the day of the procedure, how long did it take you to feel the relief?
I felt it that day.
That day,
Yes.
really? So most people are sore.
No, I had no soreness at the injection site.
Uh-huh.
Didn't need to ice it, anything. I used your
The light stem every day. Uh-huh.
Every day.
And
Mostly on my right knee. My right knee was more of a problem. than
yeah,
my left
that's
knee.
why that's kind of the temperature difference is not as much. This one's a lot better, but that's starting to repair as well. So let's go back to the day you had the procedure and you walked out. How much less pain did you have day one? Right.
A lot less.
Like, can you put a percent on that?
60, 70%.
So that 70% relief has lasted until
has.
today. That's incredible. And you're doing home light stim every
I
day.
do.
So what we do is,
When I put my makeup on, I
Yeah.
just sit there without
in order to keep the cells activated to repair, regenerate, and replicate, this is a light emitting diode. And what you do, you put it on your knee 30 minutes a day because the knee's an avascular structure, doesn't have a good blood supply. So it'll create blood flow, and that will help give nutrients and platelets for the stem cells so they continue to repair, replicate, and regenerate the tissue. It also has an infrared wavelength, which is the deepest penetrating wavelength. It has multiple wavelengths of between 630 to 810 nanometers, which research has shown is the ideal nanometer wavelength to activate stem cell proliferation. And then, did you get our nice stem cell gift box?
You did. It was very nice. Thank you.
Yep, there's an ice pack in there in case you have a bad day, if the pain's bad, just put on your knee 20 minutes on and off. How you doing with the stem cell diet?
Well, I had actually started dieting and using a paleo.
Good, because we were
free
in the
diet
ketogenic
before.
diet, because sugar actually causes more inflammation, and that'll also prevent your stem cells from proliferating. So
So-
ketogenic, you're on that.
Yes, and yeah, I drink I drink lots of water anyway, so that wasn't a problem.
Alkaline, make sure it's
the good
alkaline
news
and
is
stuff.
I've lost 18 pounds.
Yeah. So 18, and you didn't change anything except
changed
getting
my-
the stem cells.
I changed my diet.
Yeah, because now you're on the ketogenic stem cell diet.
I changed that a little bit before.
17 pounds
18 pounds.
in 1 month.
Not a month, and a half, 2 months.
Wow,
Yeah.
that's incredible.
Yeah, but that was just a lifestyle change.
Yeah, and now that you're less knee pain, you're walking more to burn more calories. It's all.
Feeling comfortable riding my bicycle.
All right. And then did they go over the Prolog diet with you?
No.
Okay, all right. That's another stem cell diet we can go over. It's like a done for you program because all the meals are in the kit. And you
I
just
like
use
to
it
cook.
Then
Yeah, that's-
use our cookbook, the
Your
stem cell
cookbook
cookbook.
is wonderful.
Yeah. I mean, who doesn't like, omega-3 eggs, bacon, and avocado for breakfast? Perfect.
Yep, it's a great cookbook.
Yeah. So I noticed before, because you had the bone and woundies, you were recommended to have a total knee replacement,
Yes.
right, for both?
I've canceled my surgery date.
Canceled that. That's incredible. All right. So what we're going to do is your next re-exam is going to be in a couple months, just to make sure you're
You
making
need to call
progress.
me. I'm going to be on my boat.
Okay, great. Where are you going?
We're going to go cruise the Canadian islands.
And now you can enjoy the offshore excursion.
That was my goal.
Or when are you going?
No, it's on our boat.
Oh, really?
Yeah, I leave Monday.
Okay, great. So before you go, we're going to give you a high-powered laser complementary booster just to boost the cells.
Okay.
And when you go, you'll make more better progress. Congratulations. And when are you coming back?
It'll be in late October.
Okay, we'll do another reval then.
Okay.
But in 2 months, we're going to call you just to say, hey, how you doing? Okay?
Okay, good.
All right. Congratulations.
Thank you.